Yo, 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 yo. Hey guys, welcome back to another amazing edition of the Best Practices Show podcast. I got a special podcast for you today. One of my dear friends in dentistry came by the studio today. His name is Dr. Uche Odiatu. He was speaking to a study club locally, and I'm like, you got to come by, brother, and let's do it right here. And so we did. And today we talk about how patients' behaviors and lifestyles can influence treatment outcomes. You have to listen to this. It is an awesome episode. I hope you guys enjoy it. We'll see you soon. All right. Yo, yo, yo. Hey, guys. Welcome back to another awesome edition of the Best Practices Show podcast. I got a special episode today. My good friend, Dr. Uche Odiatu in the house. Welcome to Milwaukee, brother.
Great to be here. I sense the energy. I feel like the pulse of the nation right on the brinks of Lake Michigan. This is incredible.
It is awesome. So you texted me last night. You're working with a study club close by.
Yep.
And you're like, I'm in Milwaukee. I'm like, no way. So here we are. And you're heading home here in just a little bit. I'm like, come by. We're going to do a podcast.
Actually, you know what? You see an open 45 minutes and you think, why fill it with meditation?
Right.
I'm going to call Kurt and have an explosion of cerebral continuity. But I'm on my way to Denver, though. I'm not going home. I'm going to Denver.
What are you going to Denver for?
There's a Seattle Study Club Friday morning, 8 to 12, 50 Shades of Infection.
50 Shades of Infection. And what did you speak on yesterday?
Yesterday was patient lifestyle habits that sabotage your treatment plans.
Oh, let's open that one up because that's a big one. So, okay, what does that mean? Give me why is that topic so important to a study club?
Well, study clubs are all about achievement, the next level, elite patient care. They do all this clinical stuff. They have their sterilization. They have the best implant parts. They have the best of everything, a trained team, a crack team. Then a patient shows up who's been up all night, loves lemon meringue pie, doesn't like his job, disengaged from work, watches the whole evening Emily in Paris, and you wonder why your implant doesn't integrate or your dry socket. Well, a whole lot of stuff the patients do at night and in their non-dental clinic time can either support your treatment or sabotage, and that's the whole. It was like all day, and it just like went all through the various levels of how patients beat the crap out of their bodies, and then they show up and you put your beautiful implant in and your complete mouth rehabilitation.
Yeah, and you've been doing this a long time. Don't you think it's becoming a little bit more dynamic? Like it's getting weirder and weirder what patients are doing. It's not patients. There's more information out there, Uche. We've got AI now. We've got great programs. We've got an industry supporting oral health, but it just seems like patients' behaviors as a whole aren't getting better.
They've done what they've always done. As cavemen and cavewomen, you go back to Lucy, 3.2 million years ago, falling out of the tree, 3 feet tall. Things weren't good then. That same lady shows up to get a couple of crowns done, and you don't ask her, does she enjoy her job, or what does she have for breakfast that morning? Lemon meringue pie and a croissant doesn't lend itself to healing because it makes the body go into Niagara Falls of reactive oxygen species and oxidative stress. And that's like keeping the fireworks next to gasoline, next to matches in the garage. And then you wonder why my garage is on fire. Your patient's on fire. Your patient's on fire.
Where do I start? Let's say I'm a dentist watching your presentation on this. Where would you start?
Well, you got to come to aha. You always talk about awareness is the first step of change. So you got to start thinking, hey, we haven't been considering this. I have sleep on my new patient questionnaire. Well, how do you sleep? Great. Okay, let's go on to the next one. Do you drink coffee? Like, there's much more to sleep than just saying, do you sleep? Great.
Right.
Time in bed isn't sleep. Most people think, I get to bed at midnight, get up at 7. And the dentist goes 7 hours. No, that's time in bed. Actual sleep, if the efficiency is 70%, it's only 5 hours.
Right.
And 5 hours, Matthew Walker, neuroscientist, said is not good. It's an inflammatory cascade at night if you sleep 5 hours. Literally nothing is healing. The immune system is not able to reboot. Memories aren't processed.
Right. Mm-hmm. Right. And with I mean, sleep is a big deal to start. That's just a whole nother Pandora's box that you're opening up. But really starting with the questionnaire and just trying to understand who these patients are before you treat them, right?
Well, I guess the intention is I want a good result.
Right.
So dentists are very, not let me say self-absorbed. We think about ourselves. So the team has been trained at Coyce, the LVI, they've been to Pankey. We got a beautiful sterilization area. I got the best, electric handpieces. I've got clinical excellence. And then you don't think about the patient's lifestyle. The patient's lifestyle can either help you look good or not. I remember Bill Dorfman said he's an average dentist, but the lab makes him look good. A really bad patient who's got really toxic lifestyle habits can make the best dentist look horrible, bleeding around your beautiful veneers because they're up all night.
Right.
They're going through a bad divorce. They're 310 pounds.
Right.
And this is their 7th diet, so.
Yeah. And let me be the dentist who's listening. Uche, I'm 32. This is a lot to think about. You're talking about behavioral things. I spend a lot of time trying to figure out clinical dentistry, how to run a practice. How do I think about this?
Yeah, great question. I think dentists have a thing called intellectual disease. They overthink everything,
They do.
When I get a question from the class, I'll say about green tea is anti-inflammatory. It's got all the stuff in it that helps metabolism. Excuse me, a question from the back. Hello, so green tea, should that be bagged or that should be loose? I'm like, are you a periodontist? Yes. He goes, how did you know? Because you think about the minutiae. They're thinking like subgingival millimeters. Health is large. Health is global.
Yeah.
And you got to start thinking globally. So don't just think about your end of it. You got to think of the patient's end. They come in and they'll either make you successful or fail.
Yeah.
So instead of starting thinking, ooh, maybe I've got to get a master's in science and a PhD in nutrition at Harvard. No, you just got to ask better questions. And then realize if you have an inflamed patient, a person on a shift work, he's got 30 days on shift and she's going through a horrible divorce. Maybe you shouldn't start the comprehensive rehab then. Maybe you should get them started into the sanitization part of the hygiene area. Start looking at lifestyle habits in terms of getting them groomed to accept good work.
Yeah.
So awareness and then starting small. And then you're ahead of most dentists who don't even think of lifestyle.
Yeah, I'm picking up what you're putting down. Let's say you're a dentist listening and you're like me. I'm a wuss, Uche. I'm learning. I'm totally buying what you're selling. And I am talking to a patient and you can see all these signs. It's not good. Mm-hmm. How do I put this into the room in a conversation? How do you do it? You see it all the time. People open their mouth and you see too much. You learn too much. When do you say, okay, I gotta say something here? And how do you do that?
No, they lumber into the operatory going back and forth. And then they put their bag of donuts on the wall with their triple cream, triple sugar coffee. They take their matted hair, put it across. They got dark circles under their eyes, only 25. Yeah. And they sit down. Can I get that pillow? Because I can't get my head back. Because of this forward head posture from mouth breathing. And I'm thinking, how do I do my 28 crown preps this morning? You're not, if you want success.
Right.
You got to start thinking about the patient. Maybe need a lifestyle turnaround. But in the meantime, though, you can still get started. And you can seem like a cutting-edge dentist by acknowledging that what the patient's lifestyle is actually going to impact the treatment. And who wants to spend $20,000, $55,000 if they know that they're sabotaging it? Because they always think, hey, your crown fell off. If I'm a shift worker and I insisted on getting my 3 crowns done and my bridge done, and all of a sudden it goes south, I say, our crown came off. Maybe I shouldn't have booked it. Maybe I should have told you that my husband and I, or my wife and I, are going through a hard time right now, and it's a rough patch, and I'm not sleeping well. We also bought a Rottweiler, actually 2 Rottweilers, and they're on the bed at night. So they get off, click, 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 back on. And my wife is also nursing the baby on the other side of the bed. And we don't have any curtains on the window. And there's a highway going by, so I'm not sleeping very much.
Wow.
And I have a small beer fridge beside my bed, which I tend to have some Miller Lite during the night. So that being said, as they ooze blood from every gingival crevice, and you realize maybe I shouldn't do a crown prep. Maybe I shouldn't take an impression.
Yeah. I thought the town that you lived in was a pretty healthy town.
Toronto's healthy, but yes, every city has their section. You can get everything in Toronto.
Yeah. I love Toronto. I love Toronto. Okay, so prior to treatment, you're having these conversations, learning, let's say in mid-treatment, there's circumstances of patients not holding up their end of the bargain. How do you start that conversation?
Well, if you're a person who does big cases and you have people in provisionals and some lifestyle habits change, you can keep them in provisionals. That's what provisionals are for, to see how the occlusion's set up, how the smile is, how they like their vertical dimension. So why not keep them that way if their lifestyle goes south? Or just like patients also go to Europe for 2 weeks and they come back. So I'm thinking, once you acknowledge it and be aware of it, you can adjust your treatment accordingly. But don't always think, I'm booked to do 4 crowns, let's do them.
Right.
Or you've been up all night. Or your husband you guys just got a puppy. So how'd you sleep? Not at all. Interesting. Yeah. So now you know that do you have an idea what a night of disruptive sleep does? University of California they did a study with 42 men. They got 4 hours sleep. Their natural killer cells, which is the special op forces, white blood cells in your immune system, are depleted 70% for 24 hours.
Wow. So
when your natural killer cells are down 70% for 24 hours, that's not a good time for that person to get sneezed on, yet alone a block, 4 crown preps, packing cord or scanning it in your arterial. The person's not going to respond well. They'll be bleeding. The patient's not going to sleep well.
Right.
They're going to be confused. They're not going to follow instructions. You'll say, don't bite on that side. And as they leave, they're eating some rock candy that their daughter gave them. So that's what provisionals are for. Once you acknowledge it, you start realizing, okay, I want success. I wouldn't say I have to change everything immediately. Dentists like to rehab and go this full thing. I'm saying all it takes is start asking better questions.
Yeah.
But in order to ask better questions and appreciating health, you have to be healthy yourself. If someone themselves looks like Santa Claus or Elvis on his deathbed, which the deathbed was a toilet, right? If you look like Elvis 5 minutes before he died, you're not going to be very convincing with patients. They're going to think, you smell like a drive-through. Why are you telling me about junk food? So that's where living the part goes in. So in my day, I will talk about provider health, because you can't take a patient on a journey that you yourself haven't been on.
Right.
You cannot take a patient on a journey you haven't been on. So if you don't appreciate health, you don't sleep well yourself, you don't wear your CPAP, you haven't exercised since grade 11 or 11th grade, you're not going to be very convincing chairside. Patients go, you know what? I see some duplicitous conversation.
Right.
Let's just go ahead and proceed with the crowns. And then as they get decay around them, they fall off in 4 years because of clenching and grinding. You're annoyed and sabotaging treatment with lifestyle habits.
Right. So you start with provider health, then you're talking patient health. Now, I have to put this into the conversation. I'm a big fan of the team. The other night when you did this presentation, were there team members there or was it doctors only?
Oh, doctors and team, which is now, obviously doctors know. Doctors go to a program on their own. They don't bring the team. There is no way anything is implemented. So the team was there that day. The team. Hygienists, admin, assistants.
And so how do I authentically, because you can see where this is going. I love this. I got to get myself together. But Uche, as a dentist, you can't carry this conversation by yourself. This has got to be a thread throughout the entire office. How do I do that?
And then give yourself a timeline. No one loses 10 pounds in a week, unless you're going to cut off your arms, So that being said, get the team involved. So that's the part of think of a journey. Say a year from now, my team's going to be wellness focused. We're going to look the part. We're going to have authentic communication. There'll be no more chance of the patient, is that special sauce, doctor? So that whole idea is to, you yourself have to get on board. Not necessarily have a 6-pack and look like, Tony Norton from P90X. Yeah. All I'm saying, just look the part. You have to have energy. Your own spine has to be good. You must be rested. You must enjoy good food. And not 100% of the time. There's something called orthorexia, which is obsession with correct eating. So that's where a lot of people go. They go from triple cream, triple sugar coffee to having 17 apps to measure their fiber, their antioxidants. And I said, that's way too much. Unless you're Michael Phelps training for the Olympics, you don't need 17 apps to monitor. I have a sleep ring. I have a fiber ring. I have a neural link ring. Too much, unless you're an Olympic athlete. Yeah. I'm at the level, what Stephen Covey calls unconscious competence. So I do things effortlessly, mindlessly, and easily without thinking about it. It's just natural. What do I want to eat before I come talk to you today? Right. Does Kurt want me on a croissant, and should I finish off my couple bottles of Miller Lite, or should I come in fresh? You know?
Well, you're in Milwaukee, so Miller Lite's plentifully available here. So
is that the local beverage?
Well, this is where it all started.
Oh, really? Look at me. That came out of my cerebral cortex.
You're feeling it. You're feeling it here. So, and on the journey, when you talk about provider health, it's funny that you mentioned that. There's a dentist, part of the community. He started going to Orange Theory. That was the first step. He's like, I got to start taking care of myself. The second thing he did was he went into his break room where his team members all gathered, and he's like, we got to change the composition of this. It was a lot of junk food. He's like, let's just make a commitment, change all of this garbage out. And they went to apples and like healthy stuff. And he said those 2 steps alone just started to change the conversation a little bit. Then they started doing education. So I like what you're saying, just bit by bit by bit, just one step at a time. And the transformation is tremendous.
Well, every step forward creates a change. And I love the way you did that. Like you put apples in the reception. Again, obviously, airport now, travel and post them down. You can wrap the apple if you want.
Right.
But an apple is essentially, if you have healthy teeth, you can buy an apple. An apple is a symbol of oral health.
Right.
At 4 grams of fiber, all the antioxidants, there's all kinds of studies that show it can help put out the fire of inflammation in the body. So a big bowl of apples would be symbolic. Wrap them in plastic if you want. They can take them for later.
Yeah.
But that symbol's saying, you come here, you'll be eating apples. So apples in the reception, a bowl of them, wrapped in plastic if you want for sanitary purposes. Staff room, kefir and dairy-free yogurt if you like, can keep for a month. Mixed nuts in separate bowls if you like.
Yeah.
All it does is saying this is the new direction we're going on. But as an owner, as a principal, as a dentist, if you're walking the talk, no matter how doubtful or uncertain people are, people actually will surrender to your certainty.
Yeah.
So in a lecture, people go, Uche talking for the birds. I heard this from my mother. They start surrendering their doubt for my certainty. You get a certain person, the doubters will slowly move in that direction. First, they'll make fun of you. Then they'll be mad. Then they'll say, where can I get some Lululemon? So that's where I take people from making fun of me, mocking me to, where do you get Lululemon in Milwaukee?
Yeah.
So it's the doubters become certain if the leader is certain and 100% conviction. You got to have 110% conviction. And that's very convincing.
Right.
To know this works.
Yeah. And like you said, you don't need to have it perfect. You just got to be consistent. Take one step at a time. Keep showing up. You know what I mean? To go from the unconscious, mind to doing automatically. I love this. So give me an idea. Like what was the biggest aha moment for a team member when you were given this presentation the other night?
Well, they might have had a donut in their hand and they're looking at me, looking at my inflammatory cascade slide. They talk about the average caveman, cavewoman.
Which is okay. Which is okay.
No judgment.
It's totally okay.
No so back in the caveman days, so 10,000 years ago to 3 million years ago, we're not meant to eat any processed sugar.
Right.
Maybe 2 pounds of honey and fruit sugar, glucose in a year, fructose too. And nowadays, 20 teaspoons a day.
Yeah.
So a muffin and a juice could be 20 teaspoons. You do the math, 4 grams per 1 teaspoon, that adds up to 64 pounds a year. So in 2023, if you're eating 64 pounds of processed sugar a year, which is not that hard. The average teenager is 40 teaspoons, so 128 pounds.
Yeah.
You're eating that every day. Your caveman body. You and I are more caveman than we think. And I know we got a lot of hair on our back and everything else, but even though we wear Louis Vuitton and Prada, we're very much more caveman. And our genes don't change much.
Yeah.
We weren't meant to eat 64 pounds to 128 pounds. We're meant to eat maximum 3 pounds. Genes don't change much. So far, 2 million year old physiology is saying, what the heck are you doing? And now the fire starts. Joint pain, brain fog,
right.
Sciatica, reflux, neck soreness, dry mouth, dry eyes. All because you're stimulating the body to be in sympathetic dominant mode, which is fight or flight. That's what sugar does to you. The body goes, hey, there's a lot of sugar in the bloodstream. Where's the fight? And it's not happening. All I'm doing is putting the rubber dam on.
Right.
So the body's going, what are you doing? So the lady who maybe had her hand on the donut, looking at me, and I never judge. I'm never judge.
Right.
And she looked at me, and she just puts it down and hides it under a napkin.
Yeah.
But now I got her because the whole idea about in non-judgment, people thrive. Like my daughter, she's 17. She goes, Dad, don't judge me. Don't judge me. Judgment seems to stop teaching and connection. So I don't judge. I smile and then I move on.
Right.
With that thing, hey, come on. This journey's a fun one.
Yeah. Yeah. Just little by little, and even the apple thing that you maybe do so many years ago. And I'm like, I don't know. I'm not the biggest fan of apples, but cutting up an apple now is an easy thing to do on a regular basis. And I completely agree. So you just got to start with little things. I want to go back to this. Part of helping patients is asking better questions. But you got to be committed to taking the time to do. People are in a hurry. Everybody's moving so fast. Everybody has too many patients. We don't meet a dental practice in the world right now that isn't busy. They're all too busy. We consistently meet, solo dentists that have 3,500 patients. And I'm like, that's too many patients. And I'll say, do you want to be everyone's dentist? And they're like, no. And I'm like, why do you have these patients? And I'm like, I don't know. And so I think what you're saying is absolutely crucial, but you've got to be committed to slowing down, asking better questions. Give me an idea. Like when you're talking to a patient, asking a question, how much time do you commit to that?
I don't. It's very intuitive. You'd be surprised how intuitive it is. I was doing a recare exam Hygienist asked me in. I came in. I do my recares exams a lot of times standing just to change my posture. A lot of belly breathing does not happen sitting down. And hygienist said, "Oh, my patient's lips are really dry. It's fall." And I said, "Well, not everyone's lips are dry." And then I looked at inside the tissue, and the gingiva was like puffy. And I said, "Just open and tonsils big." And I said, "Can you breathe in through your nose?" She goes, "I haven't since I was a teenager." I said, "How old are you?" She goes, "I'm 55. She goes, "That's 40 years ago." Okay, so 4 decades of mouth breathing. I said, mouth breathing, the body, when you mouth breathe, the body always, the brain defers and says, you must be stressed out. I said, "So cortisol's high." She goes, "I'm on anxiety medication." And she goes, "Look at my hair." She goes, "My hair doesn't grow." She goes, "I feel stressed all the time." I said, "Hygienist, good call." I said, "I like the way you saw the dry lips and the gingiva being puffy." I said, "Our patient's obviously a mouth breather." She goes, "Can I fix it?" Oh, I said, it's not overnight. I said, "Let's get a consultation with orthodontist to find out, is there room for your tongue?" I said, "How do you sleep?" She goes, "Horrible." I said, "Okay, maybe even a sleep study. How do you wake up in the morning?" She goes, "A bit of a headache." She goes, "I don't feel good." She goes, "Doc, I know you and I are the same age." She goes, "You look like my son." And I said, "Hey, we'll get you there." And I wrote down some notes. She goes, "I'm excited." Right away, she goes, she knew she was in the hands of someone who was thinking differently than, "How many crowns am I going to do, hygienist?
Right.
Could get me some crowns,
Yeah.
So right away, patient goes, "I like that guy."
Mm-hmm.
Like we're talking within a minute, just looking, being a dental detective and then a lifestyle detective. Wrote down some notes, and then we got her started with talking to her doctor about a sleep study. She was excited. You get the patient excited. Now they want to move forward. And people think, what about the crowns? They will get the crowns done. Remember, his name was Willie. What's the guy? The little guy. He had Steve Anderson used to work for a guy.
Oh,
from Austin, Texas, I think.
Yeah, Itsy Bitsy.
Itsy Bitsy said, keep a patient in recare long enough, you'll eventually do all the crowns you need.
Yeah.
But you need a live patient. You need a person who sleeps deep, eats healthy, and then I will do the crowns later. But in the meantime, let's get you alive. And then that patient will say, we'll talk to her sister on the phone. "Hey, I just met a dentist, and we're talking sleep, we're talking mouth breathing. I'm getting a sleep study. I'm excited." She goes, "Was that a dentist?" She goes, "Yeah." "Who is that dentist?" "It's Dr. Uche Ododo, I think. I can't say his name. He's an African leprechaun." So now her sister books an appointment.
Yeah.
Now we got another family coming.
Yeah.
And it was a good conversation. And leaving that 3-minute recare exam, I'm thinking this is working. That's felt awesome. Good. I felt good. I went back to my patient. So that's how it all starts. it's a total, you got to look from a global perspective. Stop looking at the minutiae of the gingival crevice. Stop looking at, how can we close that diastema?
Yeah, we always say there are people that fix teeth and there are people that change lives. It's not the same business. Mm-hmm. Go back to, you said dental detective, lifestyle detective. I love that. Mm-hmm. What does that mean? Tell me more.
I just made that up because I'm a self-perpetuating, effervescent semantic
I love
machine.
That.
But you got to think like a detective. You know, something's going on. And dentists are blessed, and hygienists. We get an hour with patients mainly. Like physicians, 7 minutes. 7 minutes. We go from a person coming with some vague pain on the lower right side, and you think cracked tooth syndrome. You get a tooth sleuth out. You're looking at the bite. You're taking a scan. Just look bigger. Start looking at the posture. Yeah. Start looking at where their hands are. Why is the purse on their lap in front of you? Why are they afraid? What's the general posture like? Is the mouth dry? What meds are they on? Are their feet clicking?
Right.
I want to see what meds they're on. I want to see, are they able to look at me in the eye? Are we connecting? A lot of patients, when they talk to you, they're looking straight ahead. There's no authentic communication when a patient is looking straight ahead. She or he is not connected with you. I'd like them to turn around or feel comfortable turning around. Most dentists come in, with their $300 figs on. They got the 17 letters on their breast pocket. Be relatable.
Yeah.
Nod. Learn body language. There's a great book called What Everybody's Telling You by Joe Navarro.
Ooh.
What everybody's telling you, and it's what the body tells you.
Yeah.
So someone has their hands across. What it means they don't feel safe. If someone's rubbing their thighs, means they have some anxiety or maybe possible sweat on their hands.
Right.
I come in fixing myself. The person says, "Ooh, this guy is doing some tension-relieving activity." So you got to look straight ahead and nod, and smile is the universal symbol of approval.
Yeah.
Open hands, not carrying any weapons, not carrying a handpiece.
Right.
So how can I help you today?
Yeah.
People say, help. Well, I want to help you. You came here for a solution.
Right.
And then as they feel comfortable, they'll turn towards you. And now the communication is straight. Now I can see the eyelids, any circles under their eye.
Right.
I can see that throat. I can see if they got dryness inside. I can see if there's angular cheilitis.
Right.
That's all part of that dental detective. I'm assessing them. So you got to be a detective. Yeah. Look at everything, not just what they're saying.
Yeah. A big conversation that happens with us and dentists all over the country is like beyond the insurance thing. Everybody only wants what insurance will cover or discretionary dentistry, which we could have a separate argument about what is discretionary. But when you're opening up the conversation about, being a dental detective, lifestyle detective, now you're getting into a range of people reaching into their pockets, using their own money to say, I trust this guy. Don't you agree? And it goes way beyond what you would ever think it would go beyond in a lot of these conversations.
You got to be so sold on lifestyle. You got to be so sold on total health. They lower their uncertainty. And I don't talk money at that point.
Yeah.
I'm just talking about hip health. I'm talking about brain health. If someone says I'm pre-diabetic, my wife has diabetes, my mom has diabetes. Well, did you know the Journal of American Dental Association, they've actually shown that if you take better care of your mouth, if you take charge of your mouth, this has bleeding in your mouth, it lowers the inflammatory burden and it makes you more insulin sensitive. It helps you manage your diabetes better, lowers the chance of amputation, cognitive decline, and stroke. They're 60 going, how come no one's told me that before?
Right.
I said, how long has it been out there? I said, no, for decades or more. Many of us just don't focus on that.
Yeah.
So as a hygienist, I said, this is great. You've got to agree with that. You've lowered the patient's inflammatory burden. Now, patient will pay for lowering the inflammatory burden. They're not going to pay for polishing. I'm lowering inflammatory burden. Inflammation is a part of every modern disease, from colitis, hepatitis, pancreatitis, meningitis. Patients are going, this is a conversation I like.
Right.
And you got to be fully sold on that information. And when you live it, money's not a problem because a hip replacement's $50,000. You amputate a toe, and what's happening on one side is happening on the other side. They amputate the other toe. Usually then the vascular innervation or the vascular circulation to each feet is compromised. Usually it's amputation below the knee, below the other knee. Depression. You start losing limbs, you got to get patients' attention.
Yeah.
And I'm not afraid. I have a picture of a diabetic toe on my phone. And one time a patient said, my toe came off. I said, between appointments?
Your toe just came up?
She goes, yeah. It goes, I took my sock off and my toe was in my sock.
Oh, no.
He goes, I saw it was turning black and I couldn't feel it. I said, okay, so this is what we're going to do. You're going to go from 6 months down to 3 months. She goes, why? Because when you manage your mouth better, you manage your diabetes better. Because no one told me that. But insurance companies now doing United Concordia 11 years ago. They said if we have a diabetic client, if we give them more access to dental, they found 11 years ago. They, as you saw, 11 years ago study, 1 million clients, they took 90,000 diabetics, gave them more access to dental, more frequency, more access to periodontal visits, pocket elimination. And they saw doctor visits went down 13% and hospitalizations for these diabetic patients went down 33% over the 3 years. A day in the hospital in the United States is $6,500.
Wow.
So if in 3 years, hospitalizations went down 33%, now you're saying it'll save an insurance company money if pre-diabetic and diabetic patients get more dental. Dental's inexpensive compared to 4 days in the hospital.
Right.
Think of a full mouth rehab, $32,000. That's 5 days in the hospital. Yeah. So dental companies now saying, a lot of Delta, I think United Concordia, some of them are now giving more access to dental if you show there's a diagnosis of type 2 diabetes. And Uche, how many people? 30 million Americans. Oh, that doesn't sound like much. Well, there's 70 million pre-diabetic.
Yeah.
So now you have 100 million pre-diabetic or diabetic patients. 1 out of 3 people in your practice are diabetic or pre-diabetic. Everyone should be close to coming in every 3-4 months if they want to manage their mouth better, if they want to lower the inflammatory burden.
Yeah, a big piece of this. I'm just going to say to you guys listening, if you haven't seen Uche speak, you have to, because your value for what you do and the profession you're in skyrockets. I appreciate what you do this profession. I know we can't keep you forever because I know you got to catch a flight, but I want you to talk about this. Dentistry and dentists specifically are better positioned to change the world than anybody. You said physicians, 7 minutes. Mm-hmm. I want you to think about this if you're a dentist. Like, you might drive to work, listen to this, go, I'm just a dentist. I just do crowns. You, my friend, are positioned to change the world more than anybody. Would you agree with that?
Oh, for sure. I love that. And it's not just rah at a retreat in Scottsdale, Arizona. It's like saying everyone else is tired.
Right.
I know dentists are a little fatigued, and we got to take care of ourselves, obviously, to ride this tsunami out there. Like it's, and we're poised. I remember I read a book called Hard Drive. This is like 30 years ago, and it said Bill Gates bought DOS for $50,000 off some scientist. And why is he a multi-billionaire? Well, there was a wave coming of software and personal computers, and he happened to buy a DOS off a guy for money. And then he sold it. Every computer, he got money back. So he was riding the wave at the right time. And who said he was destined? Skinny guy, slept under a desk. His parents supported him, staying up all night studying about computers, helped him, let him drop out of university. Well, there is a wave that's happening. And if you position yourself for total wellness, you're going to ride this wave, and it's going to last decades, decades and decades. So that being said, I think the dentists need to get in shape to be able to ride the wave. You can't be tired. You got sciatica, fix it. You got reflux, fix it. Right. If you got autonomic nervous system to function, you got to fix it. Joint pain, fix it. Get yourself a trainer. Wear that CPAP. Do that progressive muscle relaxation before bed so you can sleep deep and be ready to ride this wave. We are the gateway. And most doctors are saying, take it because we're exhausted. So the chiropractors originally were saying we're going to ride the wave, which is fine. You can tag team. And I think as a dentist, if you're referring out, I refer out to naturopaths, I refer out to osteopaths, I refer to chiropractors. And when you refer out, guess what they do back? They send patients back. I had a physician patient who does fertility treatment. He didn't know that if women in their 30s who take better care of their mouths, who are trying to get pregnant, can get pregnant 2 months quicker. This is at University of Western Australia. And he said to me, where do you find time for this? I said, I listen to audiobooks. I said, I'm reading all the time. He goes, I had no idea dentists think other than the tissue and the white parts. Right. And he goes, I'm going to send you some patients. He said, I goes, here I am. I'm one of the top fertility doctors in Toronto. Yeah. And I did not know that if a woman takes better care of her mouth trying to get pregnant, she can get pregnant 2 months quicker. Yeah. This is the wave. And I think whether you come to my program or listen to me on ACT, I think you got to catch that fire. It's got to be very convincing. Yeah, I love this. And I mentioned this before in a podcast. My wife and I went to the Cooper Clinic down in Texas. And I got a chance to meet with Tyler and Kenneth. And I spent a whole day with them. And Dr. Cooper looked at me. He said, "You work in dentistry?" I said, "Yes." He goes, "Do you know how important your profession is?" And he talked probably for 30 minutes on how important. He said, health is 70% of what happens in the hole under your nose and how you move your body. 30% of it is other factors. Mm-hmm. If you could do one thing, help people understand, health is what goes on in that hole under your nose. And he was pretty, would you agree with that statement, like type of a thing? Or I love that. Hippocrates 2,300 years ago said all disease begins in the gut. Yeah. What's in the gut has to go into the mouth first. And dentists just think mouth for chewing. It's my stag at this weekend. Let's whiten my teeth. Let's do some Zoom whitening. The miracle, what the body does, we've been doing it for millions of years, is you take liquid and food. If you take a physical part of the world, you put it in your mouth with a healthy jaw, lots of saliva, with amylase and a purifin and lysosomes, you start breaking down the world. And then you absorb it. And now it becomes my knee, my meniscus, my brain, my shoulder. It's a miracle that we do in like 16 hours, 48 hours. So, and we are in charge of the masticatory apparatus. Yeah. We are the gatekeepers. No other health profession does it. Hygienists, assistants, dentists, we are in charge of that apparatus. No one else is. Yeah. The gateway, who's ever in charge of the gateway is in charge of the body. So health is the first wealth. A good dentist, a good hygiene team, good assistant, good admin. You need a good team. And now you're that Indy 500 race car pulling up to the pit stop. And now you zoom back on. You get that checkered flag. You need a good team. Dude, you're the best. All right, I know you got to run, but give us some final thoughts on this. It sounds like an overwhelming topic. Start slow. You got to think of Bezos. When he first started, he didn't think, wow, I'm going to have a $1 trillion company. Jeff Bezos said, I want to find out how to distribute products online. I'm going to start with books. And then he got 4 books and he mailed them. And then he got 4 books and he did this. Mm-hmm. And that's how he started. He did not know the end result. And a lot of dentists want to know, I don't see the end result. Could you just take a step and enjoy that journey? And you just go to the end of the street, then turn left. GPS doesn't say, I'll teleport you there. 30 steps, turn left. So enjoy the journey and realize you may not need to see the whole staircase. Yeah. Step by step, like Martin Luther King said. So let's get a little philosophical, a little spiritual, a little religiosity on a Thursday morning. I love it, buddy. I'm so grateful you're here. And tomorrow is National Coffee Day. How cool is that? Love it. All right. So if you're listening to this podcast, if you've never heard of Uche Odiatu, I want to make sure that you know who he is. So Uche, where do I find out more about you? How do I find you? How do I follow you? Where do I go? And if I have a study club and I want you to speak to my study club, how do I find you? Simple. Just put Uche dental fitness. You put those 3 words in, you'll find me.
Okay.
I don't know where
And
you are
that's
online.
UCHE.
4-letter word. It means God's will. Little prophetic. I've got some little pressure here when I was born. God's will enters the world. So Uche Dental Fitness. You'll find me. I'm most active on Instagram. I love the stories. I love on the fly. It's like tapping into Socrates' mind. Can you imagine like 2,000 years ago?
Yeah.
You know, Socrates is like posting and the students go, this is good stuff. It's going to be around. He didn't have LinkedIn. So why aren't you online? I'll ask 1,000 dentists, you know, who's on Instagram? My daughter is. How about the rest of you? We read mostly hardcover books.
Yeah.
The new world out there.
Yeah.
Got a new world. You got to listen to books.
Yeah. Well, whole new world, and you're making the world better, buddy. Thank you for being here. Appreciate you.
I'm just a mirror of your own excellence.
Stop.
I am a mirror reflecting back to you all that is great. So,
no, I'm not kidding, man. You make my life better every time. You inspire me, and I know you're inspiring everybody out there, so I appreciate you. So stick around while we say goodbye to everybody else, but thank you guys for watching or listening to the Best Practices Show podcast. Wherever you're consuming the podcast, if you enjoyed today, which I hope you did, do us a favor, hit the share button, share this with your friends, keep sending us suggestions. I'm going to have Uche back again and again and again. Make sure you follow Uche and get him out to your study club. If you haven't had him speak to your study club, what are you thinking? He will rock the room. So until we see you guys next time or you hear from us next time, keep watching or keep listening to the Best Practices Show. You guys enjoy your day.